Close to 100 million working Americans are currently uninsured in the U.S., and lack of health care is the 7th largest cause of death in America. Despite Obama's attempts to reform health care, some claim that it's just another power grab from the healthcare industry to force poor people to buy into the system or face penalties. One of the biggest influence on the healthcare debate is the pharmaceutical industry. The industry spent $1.4 million a day on the Hill during the reform debate. And in the last decade, they spent $900 million lobbying Congress. The U.S. is currently one out of only 2 nations in the world that allows direct-to-consumer advertising of pharmaceutical pills. And prescription pills are twice as expensive here than almost anywhere else in the world. Yet this country consumes a whopping 80% of the world's painkillers. So why is America such a pill-happy nation? And whose interests are big pharma companies really looking out for? The patients or their own? Earlier, I was joined by licensed clinical social worker, Dr. Darcy Smith. In regards to America's growing prescription addiction, I asked her if she thought it was good for people diagnosing their symptoms themselves. Take a listen.
I think it's a little scary when people can diagnose their own symptoms, because there's a reason why physicians go to med school, and we're really not qualified unless we have a medical degree to be diagnosing ourselves. And it can be really misleading when we go online and we start doing all this research about various symptoms, and we don't have the foundation of the medical education to really understand what to do with the information that we're reading. So we're misdiagnosing ourselves.
Darcy, what about, this direct-to-consumer advertising that only America and New Zealand implement? Is this really causing people to consume 80% of the world's pills in this country? I mean, the pills are so expensive here than anywhere else, but it seems, is there really a link between the two?
Well, look, they've pulled out the middleman. They have found a way, pharmaceutical companies have found a way to no longer rely exclusively on the physician to market their drugs to. So they've pulled out the middleman. They're marketing directly to us, the consumers, and we are so vulnerable, as we know, which is why we are so vulnerable to advertising, which is why it's illegal to advertise for alcohol or for tobacco. And we put these boundaries in place to keep people safe, because people are so vulnerable to marketing. And these attempts have clearly resulted in exactly what the pharmaceutical companies have been hoping for and lobbying for, as evidenced by their profit margins.
Darcy, I think a lot of people trust inherently in the system, and when they see that the FDA is passing these pills through, they just assume that they're being tested and safe for human consumption. But as we see, and I'm going to show this clip of some of these commercials, but it seems like half of these commercials are just the side effects. Let's roll just a little montage of some of these pharmaceutical ads.
Bipolar depression doesn't have to consume you. Here's me, and here's my depression.
You know when you feel the weight of sadness. You may feel exhausted, hopeless, and anxious.
Let's take a look at the regulatory bodies. What is the process of really passing these pills into the public?
Well, not only is there, so there's 2 issues. One is that they're marketing directly to a consumer, and a consumer doesn't necessarily know the difference between having a decrease in mood that is a result of normal life circumstances, as opposed to something that really manifests and meets criteria for clinical depression. So a normal person is watching this on television, is saying, gee, you know what? I've been really down for the last, 2 weeks. Maybe I should ask my doctor for, and these doctors' offices are so overwhelmed because they're having to see so many more patients, because they're all affiliated with managed care. And they're having to see so many more patients per hour, and so they just want to funnel their patients out, and they do want their patients to be happy. So the patient walks in and says, gee, I think I could really do well with some Prozac or some Zoloft. I think I have some depressive symptoms, and then they start listing criteria that they researched online, and that becomes problematic. So that's the first issue. But what takes it to a whole other level of creepiness is that many drugs are being marketed for purposes that they've not necessarily been approved for. And that is really, really concerning.
Can you elaborate on what some of those have been?
I really can't. I'm so sorry.
No problem. It reminds me, was recently calling a doctor to consult about birth control, and I was basically, in a 5-minute conversation, the doctor was trying to sell me antidepressants. And it was really fascinating to me because I didn't realize, I mean, maybe you can elaborate on, do doctors have a personal motivation to sell these drugs? Are they being lobbied themselves from drug companies?
Absolutely. They are being lobbied directly from the pharmaceutical companies. They have salespeople who are out in full force whose exclusive goal is to market their drugs and to get these doctors to prescribe more and more of these drugs. And these doctors are incentivized. Now, I don't know the exact, I can't give you exact statistics on what some of these incentives are or how often they are pushed on these doctors, but there are absolutely monetary rewards to these doctors for prescribing a certain number. And there are statistics that these pharmaceutical companies have on which doctors are prescribing the most of their drug. And those doctors are absolutely being gifted trips. They're being gifted all kinds of things from pharmaceutical companies.
It is a very interesting point you bring up. Darcy, let's talk about why only America and New Zealand, but I mean, America's consuming 80% of the world's prescription pills. Prescription pill deaths have just outnumbered car crashes in this country. It's such an underreported topic. Why is it? I mean, is there just so much more collusion in this country? Is there so much more industry pushing our government? Why is it that we're one of the only 2 countries in the world that allows this?
Abby, if you look at the history of drug overdoses, you'll realize that it's only in very recent history have we been seeing the magnitude of the drug overdoses that we've been seeing. And it is a direct result of people using both pharmaceutical drugs, so legal drugs, along with recreational drugs such as alcohol or marijuana. And the combination of alcohol in particular with pharmaceutical drugs is a recipe for overdose. And we're seeing that across the board. You're seeing that with celebrities. Look at Whitney Houston, look at Michael Jackson, you know, look at the 60s. We never saw anything like this going on in the 60s. People did not die from overdosing, and they're dying now because people have access. This magnitude, this wealth of pharmaceutical drugs is at everyone's disposal. Anyone can go into their mother's medicine cabinet and help themselves to, you know, a slew of a variety.
It's a deadly concoction, Darcy, and I think a lot of people don't know the effects. They don't know the situation. We're not really being taught or educated what is, you know, what the potential side effects are when you're taking uppers and downers together. And it is really scary. It definitely needs to be talked about more. Darcy, to wrap this up, I just wanted to get your perspective. You know, here in America, we spend more per person on healthcare than pretty much other industrialized countries that socialize their medicine. Why do you think it is that Americans are so against socialized healthcare?
You know, I can't really speak to why Americans consistently vote against their own best interest. The idea that we are against socialized medicine, that we believe that government exists, you know, for nothing more than to wreak war and to fight wars and to fight battles, and that there is no governmental responsibility to keep us well is incomprehensible to me. But it does appear to be what you know, certainly what the right-wing politicians and their constituents embrace in terms of their philosophy. I can't speak to that. I don't understand how and why people vote against their own best interests. I don't understand how people think that look, the people who are impoverished many of them are getting their medical needs met, but too late. And guess what? We're paying for it anyway. That is part of why healthcare is so expensive. That because hospitals cannot turn people away, and so they are seeing people, but it's too late. There's no prevention, and more people would survive if they were getting the healthcare that they need ahead of the actual disease manifesting. And it's really unfortunate that socialized medicine in this country has become synonymous with a dirty word.
And despite the, the price that we're paying for these goods and services, we're certainly not getting the quality care that we're paying for. That was Dr. Darcy Smith, licensed clinical social worker.